Okay, this is your lecture for the 1st of April. No fooling. A little joke there. Not very funny though. Chicago Heart Association Detection Project found that men with the healthiest lifestyles had a life expectancy 9.5 years longer than other men their age group in their age group, and I can tell you that is pretty close to being true. Next year I will be going to my 50th college reunion at Wabash College. We've lost probably a third of the class, and most of those individuals were individuals that had been bad boys at some point. Besides when they're in college, they continued to drink. Some of them were smokers. A lot of them were in high stress jobs. Some of them became doctors because that's a good way to make money. Not that they wanted to be doctors. They were in a job they didn't like, and it killed them. That's very stressful, working a job you don't like. I had a friend that I guess he was in an automobile accident, but he was in advertising, and of course, advertising is it's pretty cutthroat, and he didn't like it. He didn't like the fact that it was so cutthroat, and he had to backstab people all the time. Didn't really like that. Anyway, so it all depends on your lifestyle. I've always worked in jobs that I enjoyed. Mostly, it's just that I enjoy working, and a lot of people work to retire. As weird as that sounds, and I can't even imagine retiring. For women in the same study, the healthiest lifestyles prolonged life for about 5.8 years. Hypertension is a sustained elevation of diastolic and systolic blood pressure exceeding 140/90. There are new parameters. They came out in 2017. They may be in your book. I'm not exactly sure. It's 130/80 now instead of 140/90. I can remember when I first started in medicine back in the 70s. Normal blood pressure was like 150/90 was okay, and then they lowered it to 140/90, and now it's 130/80. Blood pressure. I won't read the rest of that because the reality is that they keep lowering the expected blood pressure. Hypertension is not diagnosed until blood pressure consistently exceeds not 140/90, but 130/80. Hypertension range is now considered 115 to 130, I think, and 80 to 90. It's 70 to 80, 70 to 89 now, I think. Hypertension is the result of a combination of biological, psychological, and social factors that can include being too fat. Once again, not healthy. Of course, the reason you're fat is because you're not exercising. Dietary salts, taking in too many salts, which raises your sodium level, which raises your blood pressure, of course. Excessive stress, as I was saying about the doctors. If you don't really like the work that you do, being a doctor is fairly stressful. High anxiety and, of course, anger. Hypertension is related to anxiety and anger, especially in middle-aged men. Men 45 to 59 who score high on standardized measures are twice as likely to develop hypertension. Adolescents who report chronic, uncontrollable negative family stressors exhibit higher systolic blood pressure throughout the day, regardless of gender, ethnicity, body mass, or activity level. Prevalence varies widely among racial and ethnic groups. More African American men compared with European men develop hypertension at a younger age. And the one thing that you need to remember about hypertension is if you've got it, you don't feel it until it kills you. That's the problem with hypertension. You could have a blood pressure. Well, if you have a really, really high blood pressure, you're going to know it. But if your blood pressure is normally 160/100, you're not going to feel any. You're going to feel normal. you're not going to feel it at all. It's not like you're going to pass out. They're going to take you to the hospital and find out you have high blood pressure. It's not the way it works. If you have high blood pressure, you can live with high blood pressure for an extended length of time until it starts doing damage to your body. And then at that point, of course, they take your blood pressure and you find out you're sick. Cardiovascular reactivity is an individual's characteristic reaction to stress, including changes in heart rate, blood pressure, and hormones. Social stressors may cause sodium retention in the kidneys, which acts as a vasoconstrictor, increasing the blood pressure. Discrimination and prejudice may add to these social stressors, giving the individual chronic high blood pressure. Now, strangely enough, and I guess you wouldn't think that this was strange, but it seems odd to me that African American individuals who live in an African American community have lower blood pressure than African Americans who live in a white community. And one of the reasons is because they feel like they're being watched all the time. When I was living in Washington, D.C., the reality is Washington, D.C. is about 70% African American. When I was living in Washington, D.C., we actually didn't live in D.C. We lived in Maryland. And the county that we lived in was about 90% black. And we lived in a black neighborhood. And so I would walk my dog every day around the block, which was a huge block. It's about twice as big as any other city block. But I would walk my dog, and I really didn't feel like I was different from anybody else, or that people were watching me, or people cared who I was. It was really kind of interesting. But I can understand, just about everybody. Nobody you see looks like you. And that must be, well, wait a minute. I live on the reservation. Nobody around me looks like me. What am I talking about? I teach in a department where I'm the only non-native in the department. Yeah, and it doesn't bother. It doesn't bother me because I'm used to it, I guess. But I was standing there with who was I talking to? Jeremiah was there, and Marius was there, and Patrick Blackwater was there, and we were standing around having a bull session one day, and at one point I realized I was the only non-native in the group, and I can't remember what we were talking about, but I mentioned it, and they just laughed. They said, "Well, sometimes you act more Navajo than," well, I won't tell you who they said, but anyway, we won't go into that. Discrimination and prejudice may add to these social stressors, giving the individual chronic high blood pressure. And of course, if you feel it, then it's going to give you high blood pressure. To tell you the truth, I don't feel any more alien on the reservation than I feel here in Iowa. Of course, I'm from Indiana. Maybe that's why I feel as alien as I do here in Iowa. And actually, I don't feel alien at all. Obesity increases a person's risk of hypertension. Abdominal obesity promotes the greatest risk of cardiovascular disease. This explains why men have greater risk of cardiovascular disease as women distribute their fat stores in their breasts and their thighs, but men carry their weight as a spare tire. So when men put on weight, they don't put it on any place except around their stomachs. They don't have any other place to distribute it. But women, of course, will grow larger thighs, they'll grow larger breasts, so they can distribute their fat in different places, whereas men have no other place to put it but in their guts. Total cholesterol level of 240 or greater doubles the risk of cardiovascular disease, while below 200 is associated with lower risk. High total cholesterol and low HDL level promotes the greatest risk. HDL below 40 milligrams per deciliter is considered a risk factor. The French paradox is that the regular consumption of flavonoids in red wine and other foods may offer some protection against an otherwise unhealthy diet. So one of the things we find is that the French are healthier than most people in the United States. And one reason is because they drink so much red wine. The red wine, as I said before, has flavonoids in it. They also eat a lot of butter. They cook with a lot of butter, but when they eat much smaller portions. And one of the reasons they can eat smaller portions is because they have a lot of fat in their food, so they eat smaller amounts of food. It fills them up faster. Flavonoids lower cardiovascular disease risk in three ways. It reduces your LDL cholesterol, it boosts your HDL cholesterol, and it slows platelet aggregation. Metabolic syndrome is an individual with large waist circumference, elevated serum triglyceride. To remember, triglyceride, you're circulating fat. If you eat a lot of animal fat, then that becomes triglyceride in your system. It also becomes LDL cholesterol. Low HDL cholesterol, elevated blood pressure, and glucose intolerance, and that is what metabolic syndrome is. It usually develops into type 2 diabetes, or very often will develop into type 2 diabetes if the individual doesn't reduce their waist circumference, lower their triglyceride levels by not eating as much animal fats, by lowering their HDL or by raising their HDL cholesterol by exercise, lowering their blood pressure by exercise, and by losing weight. And of course, that will make them glucose tolerant. People with metabolic syndrome have a significantly higher risk of developing cardiovascular disease and, of course, type 2 diabetes. Tobacco use, smoking more than doubles the chances of heart attack or stroke. On average, men who smoke die 13.2 years earlier than non-smokers. Female smokers die on the average 14.5 years earlier than their non-smoking cohorts. 1 year after quitting, the risk of cardiovascular disease has been reduced by 50%. 22% of men and 17.5% of women continue to smoke even after they try to stop. I had a friend from West Virginia. I talked about him over and over and over again. He was a smoker. We used to talk about it all the time, and I told him, this is going to kill you, and he said, I don't care. I would rather die young and happy than die old and unhappy. And I said, well, if when you die, I'll dance on your grave. We were talking about that, and he said, that'll never happen. He was 2 years younger than I was. And he said, that'll never happen. You don't have a spleen. You've had a heart attack. You're going to die before I will. And of course, he died 2 years ago or so. He was 66. Yeah, I think he was 66 when he died. And I told him, I kept telling him, you need to stop smoking. You need to cut down on your cigarettes. You need to stop drinking. You need to stop smoking pot. All of these things are killing you. And he said, I'd rather die happy. And I hope he died happy, but I kind of doubt it. Type A personality, Friedman and Rosenman's term for competitive, hurried, hostile people who may be at increased risk for developing cardiovascular disease. So who gets A's in college? Well, it's the type A personality does. They tend to be just a little bit obsessive compulsive. The type B personality is more relaxed. They are not pressured by time considerations, and thus they tend to be resistant to coronary disease. Obviously, I've had coronary heart disease, but I would consider myself a type B personality. I was before the heart attack, and I think I probably am today. Type A have more rapid blood clotting. They have higher cholesterol and triglyceride levels under stress, greater autonomic arousal, elevated heart rate, and higher blood pressure in the face of challenging events. They are combat ready, which means they are hyper-reactive to just about everything. Anxiety and depression are also associated with type A and cardiovascular disease. Hostility is a toxic core of male type A behavior and consists of a negative attitude that is often long-lasting. Anger is a negative emotion accompanied by physiological arousal, usually shorter in duration. When coronary patients were given the Cook-Medley hostility scale, the researchers found that the higher the score on the scale, the more severe the coronary blockage. Less hostile patients had less coronary blockage. A study by Sheckley Et al. In 1983 of men with type A personality showed that the higher the hostility level, the more likely the individual would suffer a fatal heart attack. These individuals were also more prone to die from other stress-related diseases. So being a type A personality may make you a CEO. A CEO just died today. He was 66 years old. And he died. I'm not sure if he died of a heart attack or if he died of coronavirus. I think most of the CEOs or most of the wealthy people are betting that they're not going to get sick. Anger is a transient emotional response that is triggered by provocation or the perception of mistreatment. Anger expression is the behavior of a person in response to the feeling of anger. 20% of fatal myocardial infarctions occur because of an angry outburst. Think about this. Somebody gets angry, they yell at somebody, and then they die. Atherosclerosis risk, we're going to talk about this a little bit later. Atherosclerosis risk in communities study is a massive study of 13,000 middle-aged men and women. During the study, it was a longitudinal study, 256 of the people had heart attacks. People who scored highest on an anger scale were 3 times more likely to have a heart attack than those with the lowest scale, the lowest score on the whatever instrument they use. Researchers speculate that anger is as dangerous as more traditional heart attack risks, such as smoking, high-fat diet, and obesity. If you're happy and not angry, you can smoke, you can eat fatty foods, you can be fat. Doesn't mean you're going to live for a long time, but it means that you're less likely to die from a heart attack than somebody who's angry all the time and is hostile to other people, doesn't like people. And for this, the thing about hostility, one of the things about hostility is that there's not a whole lot of social support for people that are angry. People try to stay away from angry people. A study by Hilbert in 1994 asked myocardial infarction survivors what kicked off their heart attacks. Heart attacks were twice as likely to occur within 2 hours of an angry episode than any other cause. The individual was angry, they were tense, they had clenched fists, they had gritted teeth. And if this was the case before they had their heart attack, of course, they were more likely to have that heart attack. The most frequent cause of anger was arguments with family members, conflicts at work, and legal problems. And why did I have my heart attack? I had my heart attack because I got fired. And the reason I got fired is because I did something that the administration didn't want me to do. It had to do with my research for my PhD. It was a conflict at work is why I had my heart attack. If I had never been fired, of course, I wouldn't be here. I'd still be up there in Montana. But if I had never been fired, I probably wouldn't have had my heart attack either, and I'd probably still be playing softball. Longitudinal study looking at lawyers who were both type A and type B found that both types had heart attacks at the same rate. So just because you're type B doesn't mean that you aren't going to have a heart attack. But when hostility and anger were factored in, hostile and angry lawyers were 7 times more likely to have a heart attack just because of their proclivity for anger. Suppressed anger may be as hazardous as expressed anger. This is according to Pennebaker in 1992. Research with cardiac patients finds that when the patients deny their anger and frustration, they are 4.5 times more likely to die within 5 years of their original heart attack. And I've lived for 10 years since mine, so evidently I'm not as angry and frustrated as most people are. Moderation seems to be the saving grace. Research looking at healthcare workers found that the individuals who were the most likely to survive were those who had moderate anger expression. Other research found that feeling anxious, jittery, and nervous, and dissatisfied, sad, and sorry elevated blood pressure, and of course that's what kills you. Depression is a strongly implicated risk factor in cardiovascular disease. Geez, you can't be angry, you can't be depressed. What are we supposed to do? Metabolic syndrome. It rivals regular exposure to secondhand smoke. Depression is not simply an after effect of cardiovascular disease diagnosis, rather an independent risk factor with likely genetic and environmental causes. And of course, we do know people that whole families show a proclivity for depression. Depression remains, and this has to do with your serotonin level. If you naturally have more serotonin in your brains, then you're less likely to be depressed. It's a genetic thing. You're less likely to have a problem with depression. Depression remains underdiagnosed and often untreated in many people with cardiovascular disease, and this is really kind of serious. Doctors will see a patient. They have had a heart attack. They treat them for their high blood pressure. They thin their blood out to help their high blood pressure, but they don't care about whether they're depressed or not, and they kind of ignore it. Socioeconomic status is a risk factor for cardiovascular disease as defined by lower education level and lower income. And a European study found that people lower on the socioeconomic status scale were more likely to smoke, to eat an unhealthy diet because they can't afford a good, healthy diet, and they live a sedentary life with little social support because they can't travel. They don't have the money to travel to see their relatives. Sorry, I had to take a drink. Jobs that are the most stressful are jobs with high productivity, excessive overtime, jobs with conflicting requirements, jobs with little personal control. Geez, that sounds like this job. Oh, just kidding. I have lots of personal control over what I teach you. Job strain is defined as a job with high demands and low decision latitude. Workers who feel they have been promoted too quickly and haven't been given the skills they need to succeed feel high stress. Workers who feel stress are those who feel that they have been promoted too slowly, those who feel insecure about their jobs, and those who feel that their ambitions have been thwarted by a god-awful, horrible job. Especially complex jobs that make mental demands or require skill and training promote cardiovascular disease. Complex jobs, especially around hostile and hurried workers, is stressful. These kinds of jobs around hurried coworkers promotes a type A reaction to the stress and can cause cardiovascular disease. Fascinating stuff. When I first started at Diné College, my boss was Sarah Unsworth. Sarah eventually changed her name to Sarah Kine, but she was a little put off because I don't react like she does to things. She gets excited about things, and I just take everything in stride. So she was afraid I couldn't do the job because I didn't react as emotionally as she did, which was kind of fun. So we tangled from time to time. And loneliness and a lack of social support promotes stress, but the connection becomes more acute as an individual ages. Research by Roberman et al. In 1984, looking at myocardial infarction sufferers 3 years after the attack, had death rates 4 times higher if they had a combination of high stress and social isolation. And of course, this is something that we see in older adults, but we also see it with young adults. And now that the coronavirus is out there, we're all socially isolated. We have to be by order of the president, I guess. I'm not blaming the president. I think this is a good idea, and they should extend it as long as we need to, so that the coronavirus doesn't spread more. I understand there's a curfew on the reservation now. It's a really good idea. People need to keep their social distances. Just because you're what was I was watching 60 Minutes this evening, and there was a doctor on there, and she was saying that about half of her patients are below the age of 50. 20, 30, 40, 50-year-olds are in ICU, and they're struggling for their lives. She said when you get an old patient in ICU or an older patient in ICU, 60, 70, 80, 90 years old, their probability of them recovering isn't very high. But they still have very young people that are struggling. This could go south real quick. The assumption is that if you're a teenager, that you're not going to get it, or even if you do get it, it won't be severe. But you know, if they run out of ventilators, it doesn't matter how old you are. If you go into crisis, they're not going to have the ventilators to take care of you. Excuse me. Living alone after a heart attack is associated with the risk of a recurrence of coronary heart disease as well as a fatal heart disease. A study by Williams in 1996 found that the unmarried had 3 times probability of dying in the 5 years post heart attack. I'm really not sorry that this thing hit. I know that sounds horrible, but I was getting pretty lonely down at Dinney College, mainly because my wife is up here. Now I get to be with her. Of course, I don't think I started the coronavirus, but at least I'm home. I guess that's not very nice, is it? Women who perceive little support either in the workplace or at home are more prone to deadly heart attacks, but researchers have discovered that the quality of an individual's relationships have a mediating effect on levels of stress. So the more stress you have, but the more support you get in your relationship, the less likely you are to react negatively to the stress. Psychosocial vulnerability hypothesis: hostile adults lead more stressful lives and have low levels of social support, which over time have a toxic effect on the cardiovascular health. Health behavior explanation: hostility has an indirect effect through its relationship to other cardiovascular disease risk factors, including obesity, hypertension, alcohol, and tobacco use. Psychophysiological reactivity model: hostility and anger act slowly to damage the arteries and the heart through unhealthy increases in blood pressure, blood levels of free fatty acids, and outpourings of epinephrine, cortisol, and other stress hormones. It has something to do with sticking your tongue out at the person that you don't like. They must be third graders. Cardiovascular disease is triggered by physiological vulnerability in conjunction with a variety of psychosocial factors in a person's life. Stress from work and home environments, availability of social support, cognitive emotional states such as hostility and anger. For every 1 point drop in diastolic blood pressure, this second or the lowest number in your blood pressure, it reduces the chances of a myocardial infarction by 2 to 3%. Unfortunately, hypertension is often symptom-free, as I said before. You can have a high blood pressure and not have a clue that it's there. Means of controlling hypertension include lowering your sodium intake. This is especially true for African Americans. They seem to be more sensitive to salt. African Americans. However, if you go over to Africa, people that live in Africa do not have the same reaction to salt that people in the people of African descent in the Americas have. As weird as that is, and the reason has to do with the fact that they were brought over in slave ships. The ones that were sensitive to sodium weren't given enough water, and they died before they made it over here. So all the people that most of the people that made it to the Americas on the slave ships, they have they're sensitive. They retain salt. That's the deal about these guys. Reduce and so they're more sensitive to sodium. Uh, Reducing excess body weight, exercising regularly. I have a daughter who eats so much salt, and she's done it all of her life. She eats lots of pickles. She eats pickled vegetables. She eats, and she puts salt on them. She'll take popcorn and she'll put extra salt on it. She has just always consumed a great deal of salt. And she doesn't have high blood pressure. Researchers have discovered that a good way to control cardiovascular disease is by reducing cholesterol by limiting intake of animal fats and hydrogenated oils. No more than 10% of your daily intake of calories should be from saturated fats. Checking your cholesterol periodically to determine HDL-LDL ratios is quite important. And of course, if you're a female, if you're still ovulating, then your estrogen will raise your HDL level and it'll lower your LDL level. So you really don't have to worry about it until you go through menopause. Reducing the risk of cardiovascular disease takes a committed lifestyle, which includes a combination of stress management, aerobic exercise, relaxation training, smoking cessation, and a low-fat diet, such as the Ornish program. I don't know, I'm not exactly sure about the Ornish program, but there you go. Stress management following a cardiovascular episode may lower rates of mortality and morbidity, by increasing your social support, promoting positive thinking, lowering hostility, and possibly religious involvement. Controlling a type A personality can go a long way in improving someone's chances of surviving as a heart attack victim. Controlling hostility and anger are paramount in increasing longevity. Hostile people are more likely to encounter stress and less likely to have stress-busting resources such as social support. Interventions focus on identifying triggers of anger, developing strategies for coping with aggravation, helping participants challenge cynical attitudes, and modifying unrealistic beliefs and expectations. Okay, we're done with hypertension and cardiovascular disease. Let's talk about, diabetes. In normal humans, and when I talk about normal humans, I'm talking about humans without diabetes or hypoglycemia, glucose is regulated by the action of insulin and glucagon. Glucagon stimulates the release of glucose, causing blood glucose levels to rise. Insulin decreases blood sugar by causing cells to take up glucose. That's insulin's job. Insulin tells your cells you need to take up this glucose and use it as energy. Insulin and glucagon are produced in the pancreas in cells called the islets of Langerhans. Type 1 diabetes is an autoimmune disease where the immune system attacks the islet cells that produce insulin and glucagon. Diabetes mellitus is a disorder of the endocrine system in which the body is unable to produce insulin, that's type 1 diabetes, or is unable to properly utilize this pancreatic hormone, type 2. There is no known cure for diabetes. Heredity and lifestyle seem to play a role in both types of diabetes. Diabetes affects 25 million people in the United States. That's about 8.3% of the population. And mostly it's because people are too fat. Diabetes is the third most common chronic illness. It is the seventh leading cause of death in the United States. Annual cost of diabetes is $174 billion a year. People who have diabetes are twice as likely to die as cohorts without diabetes. It is estimated that 57 million people in the United States are pre-diabetic. Wait a minute, what do we have over here? 25 million people are diabetic, and 57 million people in the United States are pre-diabetic. They have a blood sugar that is high, but not high enough for diabetes. People who are pre-diabetic are at an increased risk to develop type 2 diabetes, heart disease, or have a stroke. Prevalence rates do vary around the world. Diabetes is absent or rare in select developing countries in Africa and Eastern Mediterranean and Western Pacific countries. Why is it that way? It's that way because they don't have the food. They don't have the rich food that wealthier nations have. And because of that, of course, they don't get obese. However, rates run from 14 to 20% in some Arab, Asian Indian, Chinese, and Hispanic American populations. In the United States, African Americans, Hispanic Americans, and American Indians have higher rates of adult onset diabetes than European Americans, Asian Americans, or Cuban Americans. Type 1 diabetes has also been called juvenile diabetes or insulin-dependent diabetes. Type 1 diabetes is an autoimmune disease in which the immune system attacks the insulin and glucagon-producing islet cells of the pancreas. Symptoms of type 1 diabetes include excessive thirst and urination, craving for sweets, weight loss, fatigue due to the body's inability to metabolize glucose for energy. Peak incidence of type 1 diabetes occurs around puberty, 10 to 12 years of age in females, 12 to 14 years of age in males. Type 1 diabetes accounts for 5 to 10% of their diabetes cases. This is really kind of interesting. This has to do with the ages of type 1 diabetes has something to do with exercise. If you're playing in a recreational league, the league usually goes up to about 12 or 14, and then you break out into the elite athletes. And of course, when that happens, there is less exercise for everybody, both females and males. Type 1 diabetes accounts for 5 to 10% of all diabetes cases. Symptoms seem to mimic the flu: excessive thirst, frequent urination, unusual weight loss, extreme fatigue, and irritability. Type 1 diabetes requires insulin injections, of course. The people at greatest risk for type 1 diabetes are people with a family history of type 1 diabetes, children or parents with type 1 diabetes, siblings of people with type 1 diabetes. Type 1 diabetes affects males and females equally. Highest prevalence rates are among European Americans. That's type 1. But when we go to type 2 diabetes, its prevalence rates are higher with minorities, select minorities, of course. Type 2 diabetes is also called adult onset diabetes or non-insulin dependent diabetes mellitus. Type 2 diabetes is a more common and milder form of the disease that usually appears after age 30 and accounts for 90 to 95% of the diabetes cases in the United States. When I first started in medicine back in the 70s, we hardly ever saw type 2 diabetes. And the reason was because people were getting a lot more exercise back in the 70s. Then all of a sudden, the food changed. The people were eating. They were eating a lot more junk. They were consuming a lot more sugars. They were consuming more diet drinks. And I just wonder if that has something to do with it. Type 2 diabetes results from insulin. You saw how skinny women were back in the 1970s. It's just not that way anymore. People aren't that slender. People just don't go outside and exercise like they used to. Type 2 diabetes results from insulin resistance, glucose intolerance, where the cells either become intolerant to insulin or insensitive to it. Type 2 diabetes affects more women than men. Type 2 diabetes requires strict regimen of diet and exercise. Type 2 diabetes is more prevalent in people over the age of 45 with a family history of diabetes. Type 2 diabetes is more common in people who are overweight, and that's why I have the picture on the right. Type 2 diabetes is more prevalent in people with a low HDL cholesterol or high triglycerides. Symptoms of type 2 diabetes include all types of symptoms of type 1 diabetes, all the symptoms of type 1 diabetes, plus blurred vision, frequent infections, and this is an infection in the joint of the big toe, cuts that are slow to heal, tingling or numbness in hands or feet. While type 1 diabetes is more common among European Americans, type 2 diabetes is more prevalent among minorities, African Americans, American Indians, Hispanic Americans, Asian and Pacific Islander Americans, people of a low socioeconomic status. It is predicted that 7.2% of the population will have type 2 diabetes by 2050. Hypoglycemia is where the blood sugar level is too low. Diabetes is actually chronic hyperglycemia, where the sugar level is chronically too high. Unregulated blood sugar increases the risk of many health complications, including the development of atherosclerosis and cardiovascular disease. As a matter of fact, one of the side effects of diabetes is atherosclerosis, is hardening of the blood vessels, and for this reason, it is more difficult to get blood to your extremities. So one thing, I was in a doctor's office a couple months ago, and he had a sign on the wall that said, "If you're a diabetic, please ask me to check your feet." And the reason is because, well, they can sometimes they have a hard time feeling their feet. They get numb in the feet. They get tingling in their feet, and for that reason, if they have an infection, a lot of times they don't know it. So sometimes they'll have abscesses, they'll have cuts. If they develop a fungus, it will split the skin around their toes, and they don't realize it, and they need to make sure that it hasn't become infected. About 5 to 10% of women will develop temporary situational diabetes during pregnancy. Somewhere around the 4th or 5th month, the demand on their body will result in a greater demand on their insulin than they can produce. The diabetes will not persist beyond the end of the pregnancy, but this woman will be more prone to type 2 diabetes in the future. My sister-in-law, with her last baby, had this. She didn't have it with her first 2 children, but she had it with her last child. And she was okay for about 10 or 15 years. Then she developed type 2 diabetes. So in her case, she was pre-diabetic. And the pregnancy showed her and should have told her that she needed to exercise more. She needed to control her diet better. She didn't, and eventually it killed her. Most of the women who develop gestational diabetes are pre-diabetic. 5 to 10% of women will continue to have type 2 diabetes postpartum. Complications that can develop from type 2 diabetes include heart disease and stroke, retinal damage and blindness, dental disease, blood vessel damage, nervous system damage. Diabetes may be caused by multiple factors, including viral or bacterial infections that damage the islet cells, an overactive immune system, genetic vulnerability. Obesity is a known cause of type 2 diabetes. Nutritional westernization is also a risk factor. Diet high in fatty and processed foods. About 30% of overweight people have diabetes. 85% of the people with diabetes are overweight. The more fat tissue a person has, the less sensitive the tissue is to insulin. Poor diet may partly explain why some racial and ethnic groups are at increased risk. Increased TV watching associated with reduced physical activity, of course, can cause the same problem. Fat cells release a protein called pigment epithelium-derived factor, or PEDF, into the bloodstream, which causes muscle cells in the liver to become desensitized to insulin. The pancreas attempts to compensate by producing more insulin. As the person gets more and more obese, the pancreas may react by slowing or even stopping insulin production. Stress has been noted as a factor in diabetes, especially those suffering from type 1 diabetes. Researchers have discovered that people suffering from type 1 diabetes have greater variability in their glucose with stress than people who do not suffer from diabetes, to the extent that normally when you eat a meal, you know exactly how many calories are in the meal. A diabetic is will be able to inject themselves with insulin to take care of that meal. If they are under a great deal of stress, they will need more insulin. In other words, they will go into acidosis if they are under a great deal of stress and they take a normal amount of insulin with a select meal. Sorry, I needed another drink. Abnormal blood sugar responses to challenging events in conjunction with high levels of stress may directly contribute to diabetes. Stress may also indirectly promote diabetes by reducing compliance with treatment. Most people with diabetes can control the disease through lifestyle change or modifications, changing diet, regulating their weight, exercising regularly, using insulin if necessary. Patients' knowledge, beliefs, and behaviors strongly affect the ability to manage diabetes. This has to do with feelings. Isn't this weird? Here we have this medical condition, and your feelings can adjust your insulin level. Stress can adjust your insulin level in your body. Self-management is the cornerstone of treatment. Most people are able to control their diabetes through lifestyle modifications, by changing their diet, by regulating their weight, by exercising regularly. If needed, they inject themselves with insulin. Circulating glucose can be monitored through finger sticks or venipuncture. Hemoglobin A1C is the glucose being held in the red blood cells, and it gives the physician an idea of glucose levels over time. Hemoglobin A1C measures good glycemic control over time. So if you're diabetic and you go in to see your doctor and you've been a bad boy or girl for most of the month, but you decide, oh geez, I got to go see the doctor in a week. I'm going to be a good boy or good girl for a week. He can draw your A1C and find out that you've been a bad boy or girl for the rest of the month. That's what A1C is. Diabetes can either be a challenge or a death sentence. Diabetes sufferers must manage all aspects of their lives: glycemic control, healthy eating, physical activity, foot care, taking needed medications, problem solving, and active coping. This is an individual checking their feet to make sure that they don't have an infection. In 2031, women of Hispanic heritage, Latinas, living in the United States have a prevalence of type 2 diabetes that is almost twice that found for non-Latina white women, and this is according to the National Center for Health Statistics in 2007. If current trends continue, over 20% of the Latino population overall is expected to have diabetes by 2031. Now, why in the world would this be true? What in the world's going on here? Well, what is going on is that individuals of Hispanic descent, American Indians, potentially guys evolved eating different food, eating a lot more red meat, eating fewer vegetables, certainly eating less sugar. If you are American Indian or Hispanic, potentially you should stay away from sugar completely. Certainly stay away from alcohol, because alcohol turns into sugar in your stomach almost immediately. So somebody who is, the worst thing in the world is for a diabetic to drink because they can't regulate their sugar level, especially if it's there are lots of different factors as to how fast alcohol is metabolized in your body. But it may be because American Indians and Hispanics have a native ancestry, and that ancestry was kind of short. And of course, in this day and age, with less exercise, people who are short accumulate fat in their guts. They need to control that. I'm going to stop right here, and this is, I think, what I'm going to do for the rest of the semester. I was going to throw out chapter 13, but I think I can include it now. Next week, I will just lecture over chapter 11. Once I'm done with chapter 11, then I am done for the week. So next week, I'll do chapter 11. The next week, I'll do chapter 12. The next week, I'll do chapter 13. Chapter 14, the last week of the semester, and then the last week I'll do chapter 15. So we're caught up. Now, right now, we're caught up. So congratulations. I'll see you next week. This is the second lecture for the week of March 30th through April 5th, it looks like. Okay. I'll see you guys next week.